Hello, everyone. Welcome. We are so excited to be here tonight. We are joined by Dr. Ojo-Carons and Dr. Karcher, who is a sex therapist. We are here tonight to talk about low libido. And I don't know if you are joining us from the Eastern Virginia region, but it is quietly storming here. So I think it's the perfect vibe to talk low libido.
The quiet storm.
A little bit of thunder and lightning, yeah.
So we have so many questions. We'll try and narrow it down, and this is by no means going to be comprehensive, but we will try and cover the basics. Dr. Karcher, do you have anything, or Dr. Ojo-Carons, that you want to say before we dive into questions?
I'm ready to get into it.
Okay, all right. So what is low libido, and how do you know if you have it? Because you cannot compare yourself to your friend whose may range from, her libido range may be 7 to 10 and yours may only ever be a 3 to a 5. So how do you know if you're where you are in your own personal range?
Well, what is libido? It's your psychic sexual energy, right? You could broaden it to say it's psychic energy generally, but when we talk about it, we're mostly talking about desire for sex, interest in sex, and we imagine that comes up as spontaneous, that because that's what it did when we were, starting at whatever age around puberty, right? And that we just, got the idea out of nowhere, and that's what we think is the norm. One of my favorite books on this, Come As You Are by Emily Nagoski, talks about responsive desire, which is really important to know about. So she goes into all that and said, this is a huge part of great sexual functioning and great relationships as you go. Responsive means that you didn't have that original idea, but you can respond to it if the opportunity comes up, whether it's a solo opportunity or your partner says, hey, we've got some time. So the main thing about low libido, is it causing me distress? Now, sometimes distress can be my partner and I want different amounts or at different times. So we call that desire discrepancy. And that gets kind of complicated, as you might imagine. If you're not partnered, or if you're really convinced that it's all you, then, there are lots and lots of factors, particularly your health factors, that we want to look at and kind of say, how are things going in your life? Are you super stressed out about things? If so, then it might be a very normal, natural response to all that stress for your sexual desire to just tank. So is it causing you distress? And then let's talk about that.
Mm-hmm, mm-hmm. And Dr. Ojo-Carons, is this something that many patients bring up to you?
On a regular basis, yes.
Really?
And I will say patients from all age groups, especially postmenopausal, but all age groups, definitely. I do hear this same question. And I love, Dr. Karcher, how you phrased your answer, in that there is a psychosocial component combined with stress that may affect your libido. And I think a lot of times women forget that does play a big role in level of desire.
When we were doing our pre-call before we made it to this point where we're going live, you recommended another book, How to Have Ridiculously Good Sex in a Long-Lasting Relationship. And I'm halfway through it. And one of the things mentioned was that, we do live different lives than we did. We've evolved into busier, more stressed out lives. So it is sex is a leisure activity. So you have to have time to be leisurely. So I found that part of the book really interesting and helpful. If somebody finds themselves having low libido, is it permanent, or what might be other causes?
Well, it's actually over the lifespan. I mean, starting from puberty generally, although we won't get into before that, it's complicated. But starting from puberty, it's absolutely normal for desire levels to wax and wane over the lifetime. They might wax and wane over a long period of time, or it could be practically a day-to-day thing with stress, tiredness. Are you getting enough sleep? Do you have any time to yourself in your day? Right? If you're too busy thinking about all your pressures, that's a big problem. There are 5 things. Dr. Barry McCarthy is a prominent sex therapist that is just fabulous at helping couples and training therapists and working on all this stuff. And the things that he said, the biggest desire killers that he lines out are anticipatory anxiety. So in other words, you're worried about how it's going to go. Performance anxiety, and that can be both men and women. We're kind of familiar with men going, am I going to perform right? But women can also feel like, I'm going to be expected to have an orgasm, or I'm going to be expected to be really wildly enthusiastic, or, so both people can say, is my partner going to be happy with how this goes? Am I going to be happy with how this goes? Or am I going to be disappointed in myself or worried about, what does this mean? I'm not really on tonight. The other 3 things he mentioned are anger is a problem, right? Kills desire. Coercion kills desire. That's probably a good thing. And routine can kill desire. And it's funny, he didn't put stress on there, but I put stress on that list. So.
Wow, I don't know. I don't know if it's too much of a giveaway if I'm over here just wildly nodding.
We can all relate these days, right? Right.
It's true. I oftentimes have patients that believe, and I think this is probably the norm, just across the board, both men and women, that their libido level is directly linked to their hormone level. There are many different types of hormones, first of all, but their hormone levels, I assume for women, they mean their estrogen and progesterone. And in my field, the main treatment for libido is to give a woman back estrogen for someone who's postmenopausal. Do you have any thoughts on that, Dr. Karcher?
Yeah, that gets complicated too. And a woman really should be talking to her OBGYN about her hormone levels and about possible health factors that could be affecting everything, because there are many, and all the therapy in the world isn't going to get you anywhere if you've got a health problem. So we've got to, that's essential. And then part of that conversation is about where your hormones at. Just giving women extra hormones aren't necessarily going to solve the problem. There's not a quick fix for these. It's really good to kind of work in concert with either a sex counselor or perhaps a sex therapist. And there are 3 types. There's sex educators. They're all informational. There's sex counselors, and they're really informational and good on talking about problems, right? And then there's sex therapists who can help you dive into more different kinds of things, like what's really going on in your relationship. Is it a stress you're not all that tuned into, or stress between the 2 of you? Is there a trauma in your past? I mean, it could be way back historical programming that's actually really affecting you. So, there's different levels of who you might want to talk to, but you really got to start with, checking out your health. And yeah, hormones are definitely a factor. You want to know where you're at.
And you mentioned in one of our emails that there's a governing body. What's the name of that, so people can make sure that the person that they find to work with is through that? ASECT, I think. It's
ASECT, AA, 2 A's on the front of it, kind of funny. AASECT. So it's the American Association of Sexuality Educators, Counselors, and Therapists.
Okay.
So it's asec.org, all those letters.org, and you can find them. They have a directory. The directory lists all over the country, lists educators, counselors, therapists, tells you what type, each person is, and all the people in the directory are certified. There are other ways to get certified, or other certifying bodies, but ASECT is the biggest and very rigorous and standardized.
Okay. This is so great. I maybe I'm wrong, but I'll speak from my personal experience. It's not easy for me to reach out to a therapist, just a regular therapist, let alone a sex therapist. And has been so helpful for me, who's kind of needs to feel comfortable before I make that next step, to read books to kind of educate myself a little bit more so it becomes normalized in my own mind before reaching out.
Sure.
So there's a great resource that you shared that I'm going to drop into the comments section, sexualityresources.com. I can answer a lot of questions. Is there anything you want to add about that resource?
Yeah, especially in light of what you just said. In terms of reaching out, there are the two co-owners of the site, and the site, by the way, has great resources in terms of all kinds of lubes. Even if you're really sensitive to lubes, they really look at the ingredients, what works well, what your purpose is. They're very educational about it, and they've got really good ones. They've got toys, they've got articles, they've got books, they've covered the gamut. But one of the cool things from what you just said, there's Ask a Sex Counselor, and you can type in your questions. And one of the co-owners of the site, Ellen Bernard, responds to that. She is a certified sex counselor through ASECT, and extremely knowledgeable about all these products. They, vet everything, and they're very careful about what they list and why. They're very upfront about why. And then there's Dr. Myrtle, who is an epidemiologist, but has been doing, she's an MD, has been doing this for 25 years in terms of education, and so answers the more sort of technical medical ends of questions and so on. And between the two of them, there's a whole list of archives of questions that you've probably thought of, or even if you haven't, you'll go, oh, I want to read that one, right? So there's really great stuff, and that's a great way to reach out anonymously and say, this weird problem, what about it? And they're really responsive.
Wonderful. We've got some questions from the audience. Dr. Ojo-Carons, I didn't mean to cut you off.
Oh, that's what I was just going to say, the audience questions. One asking about nutritional options that can aid in increasing libido. From what I've gathered from what you said, what you have said, it's really important that you remain healthy overall. But are there any specific nutritional options that you can think of that would help with libido?
Anything that helps your stress level. There's a couple good books out there, which I don't have in front of me, but on anti-anxiety diets. And if you feel like anxiety is a factor for you, or particularly if you have panic symptoms, anxiety is a factor for you. But if you have those kinds of aspects of pressure on you, an anti-anxiety diet, you want to look at elements of that and see where maybe you could improve. But also, again, ask your medical provider, how does my health picture look? Is there something I need? Do I have deficiencies?
Yeah. Another question here is, how does PCOS affect libido? And I think that's a wonderful question. Women with PCOS have higher androgen levels. And the way I describe androgens is they're the male-like hormone that women have. We have different types of androgens, and we have different levels in our body as women compared to men. And so women with PCOS have higher androgen levels. So that's a really good question. I think it just comes back to your point, Dr. Karcher, that you really have to have whatever chronic disease or disorder that you have managed. And if you're not managed well, that definitely can affect your libido. And so with PCOS, definitely, I would say there are many forms of medical management. Ties right back into the question about nutritional management. There are ways to manage PCOS with nutrition to improve your levels of estrogen and decrease the androgens or testosterone. So that's a really good question.
Yeah, I love it. It feels like a holistic thing because it is, like you started out saying, there's so much psychology that goes into it as well as your body. So you kind of have to work with them in tandem.
Yeah.
Well, and so let me just read a quote that I've caught today looking at Dr. Myrtle on the Sexuality Resources site. And so Dr. Ojo-Carons, you, I'm sure, could weigh in on this at length. And I don't know if you'll agree, but Dr. Myrtle's point said, hormones are to libido as icing is to cake. Said hormones may enhance an underlying desire, but they aren't responsible for developing the desire in the first place.
I love that quote. Absolutely.
Wow.
Yeah, it's true.
They can mess you up, but not necessarily fix you. So
it's not the only answer. You're definitely right. Definitely right about that. Yeah. We have to look at ourselves, our health status. We have to look at our stress levels, and that really plays a role in many of the things that we've discussed, Hannah, here. managing ourselves as entire human beings, as whole people, not just as a whatever our one concern is. We have to manage our lives and our health completely. So yeah.
And this is a part of it. This is a big part of it.
Yeah.
Gosh, Dr. Karcher, thank you so much for joining us tonight. This has really, really been so informative, and I have so many rabbit holes to go down now.
Well, good. Maybe I can join you again and we'll explore some more rabbit holes. So
we'd love it. So if you're watching and there's some questions that we didn't quite get to, I'm sure there are, please reach out to us through any of our social channels and let us know. Dr. Ojo-Carons, anything else you'd like to say?
Dr. Karcher, thank you so much for joining us. And to all that have joined, we have Dr. Karcher's contact information posted in the post, and we'll also post it on our socials too.
Okay, and I'll just add one other thing, that most therapists, at least these days, the majority will give you a 15 to 20 minute brief consult to figure out if you feel like they're a good fit for you, and find out if what you're wanting to have addressed is in their area of expertise. So that's pretty cool, because you get a feel for them, right? It's free. You can talk to several therapists. That's a good thing, really. Learn a bit more with each one. But I would say reach out. If you're thinking about therapy, reach out and say, hey, this is not all that comfortable for me, but I wanted to talk to you and see what you thought. And you'll get a feel for the person. So that's a good way to get your feet wet.
Wow. Wow. That's really comforting to know that you can do that. I'm so glad you said that. Great. Well, we could go on and on, but we'll cap it there. Thanks everyone for being here, and good night. We'll see you next time.
Good night. Thank you. Thank you.
Thank you.